American football has long been part of the U.S. cultural fabric, so much so that during the season, fans consider Sunday synonymous with football. The National Football League and its 32 teams bring in more than $13 billion in total revenue, and that's about the national GDP for Jamaica, Nicaragua, or Laos. But a recent report showing that playing football is linked to an increased risk of long-term neurological conditions could have disastrous effects for the American pastime. The report found chronic traumatic encephalopathy, or CTE, present in 110 of the 111 brains of deceased NFL players. CTE has been linked to a whole host of symptoms, including memory loss, confusion, depression, dementia, and increased aggression, all which could arise even years after a player has suffered the last blow to their head. Football player John Urschel recently made a surprise announcement that he is leaving the NFL just after 3 years in the league. He made his announcement 2 days after the CTE study was released. The lineman for the Baltimore Ravens walked away from his football contract to focus full-time on continuing his doctorate in math at MIT. The effects of the study could also impact college football, which brings in more than $9.7 billion a year in revenue, all due to the work of unpaid collegiate football players. But despite increasing awareness of CTE, data shows that there's been an increase in the number of children aged 6 to 12 playing the game in 2015, according to ESPN. So is playing the game worth it? For some American families, it seems so.